Hello, and welcome to Targeting Your Health, a program that helps you understand the aspects of modern medicine that can be critical to yours and your family's good health. I'm Michael Bass, Professor Emeritus of Physics, Electrical Engineering, and Optics at the University of Central Florida. I got my PhD in physics, so I could be called Dr. Bass, but that's completely unnecessary. Mike Bass will be perfectly fine. Today, I have the pleasure and honor to bring to you Dr. William Mallon, a practitioner in the field of ophthalmology, or for the rest of us, issues concerning the eye and vision. He has promised to talk to us using everyday language. Dr. Mallon, would you please tell our viewers a bit about yourself and your background and your own expertise?
Sure. So I graduated from Michigan State University with a BS in physiology, attended Wayne State Medical School where I received my MD degree, and then went on to Memphis where I spent 5 years. My first year was an internship, general internship, where I did internal medicine, surgery, general surgery, emergency room, kind of a 12-month rotating internship. And then I proceeded to complete my 3-year ophthalmology residency at the University of Tennessee in Memphis. Once I completed that, I went on and did a year of special training in ophthalmic, plastic, and reconstructive surgery. So that's mostly a specialty dealing with problems with either mechanical or functional issues with eyelids, orbits, the area around the bony area around your eyes, as well as the lacrimal system, the tearing and tear drainage. And then once I finished that, went out in private practice and have been in Vero Beach for the last 20 years.
Well, great. I've been here for 32 years in Florida and 28 years in Vero Beach. But since it's uppermost in most people's mind at this time, let's hear your comments on the COVID-19 pandemic, how you deal with it here in your practice, and what suggestions you might give to the listeners, the viewers, about it.
So obviously it's been on the minds and thoughts of everyone, and it's had wide-reaching effects on all of us, including us in the medical practice. Obviously our concerns are most with protecting our patients, keeping our patients safe, and yet still being able to provide the services that they need. Eye emergencies and eye and vision loss doesn't stop just because there's a COVID-19 pandemic. So we've had to adjust. Mostly what we're seeing now is emergencies and urgencies in the office, and that can vary from somebody has a corneal abrasion or a corneal ulcer to they have flashing lights and floaters and may have a retinal detachment. A lot of what we do, most of the things in ophthalmology can be put off if they need to be, elective things, but there are certain things, particularly with my partner Dr. Katz, who does retina surgery or does retina treatments, particularly for macular degeneration. There are patients that receive shots many times monthly, and if they don't receive those shots, they can actually lose their vision permanently. So retina patients are probably the ones that we've been seeing the most of. We also have patients with glaucoma or elevated eye pressure, and if that eye pressure gets to a certain level, it can rapidly cause a decrease in vision and permanent vision loss. So we've had a mix of patients that we've been seeing. Obviously social distancing as much as we can, but to examine patients, we have to look at them and get relatively close to them. So wearing masks, washing your hands, all the things that we typically do as doctors anyway. I mean, we're always exposed to people who are sick. That's what we do.
Sure.
When people are sick or they have an eye problem or any kind of problem, they're coming to the doctor. So, we're exposing ourselves, and our staff are always exposed to people who are sick. But we're being particularly careful with people who are coming in with a history of fever. We're checking them at the door. We're limiting the exposures by not having people come in with companions if they can avoid it. And also we've incorporated our telemedicine platform. So one of the things that Dr. Katz and I have been working on is a company called GlobeCheck, and it does an eye exam, typically a complete eye exam with all of our testing in 7 to 9 minutes. And that can be done at our mobile kiosk. So we can complete an eye exam on a patient where they don't have any exposure to anyone other than our technician who is in personal protective equipment. The patient can have their scans done, and then what they do is leave, and we review their testing, and they schedule a telemedicine visit with us where we do a video consult. So we can review all their studies. One of the things that lends itself to telemedicine and ophthalmology particularly is a lot of what we do is testing. We take pictures of the back of the eye, we take ultrasounds of the retina and the optic nerve, We even map out the surface of the eye, the cornea, the front part of the eye. So a lot of what we do is testing and then interpreting and reviewing those tests to come up with a plan for a patient. So it lends itself very much to doing eye exams and detecting the most common causes of vision loss and determining whether someone actually needs to be seen in an emergent or urgent or non-urgent way, and that allows us to triage our patients. Those who are in need of care, we're able to provide that care without exposing them. And then if they don't need to follow up with us in the office, we're able to say, we'll see you at some later time. Those that are required to see us, we then figure out the way to bring them in the most safe manner.
Well, that's quite a thorough change in the way you do things.
It's actually brought what we've been doing over the last 6 years, and this was really intended to try to eliminate the type of blindness that can be prevented. And about 80% of blindness in the United States can be prevented with proper follow-up and treatment. And what we realized is that most people in America are not getting eye care. So how do we do something that's going to make it easier for people to receive eye care? GlobeCheck has been something we've been working on for 6 years, and with the COVID crisis, it's actually brought us to the forefront of telemedicine.
I'm hoping that this session of the Targeting Your Health will help people understand what these issues might be. By the way, we hear a lot about not touching your face, and most people figure that's because you don't want to get it near your nose or your mouth. And I've not yet seen a clear statement. Does it enter through the eye?
Oh, sure, absolutely. Yeah, I mean, any mucous membrane surface, touching your eyes, and we touch our face hundreds of times a day.
I know it makes you very conscious of that.